Hi everyone, warts in pregnancy. What are warts? Warts are little outgrowths caused by the human papillomavirus. There are over 200 different types of human papillomavirus, and the reason why they're called human papillomaviruses is because they're found on humans. Lots of humans. Many humans, near enough. All humans have come in contact with the human papillomavirus at one time in their life. Ever had verrucas as a kid? Well, there you go. Verrucas are caused by the human papillomavirus. Also, warts on the hand due to gardening or whatever you've done. Yeah, these are really common viruses. And so if you haven't got the HPV virus now, you will get it sometime in the future, near enough. Guaranteed. So don't worry about it. If you have warts during pregnancy, this is unfortunately quite a common occurrence. And what should you do? You can leave them alone. A lot of people though decide they want it treated because they don't want these type of things on their genitals. And so the easiest way to do it, if they're not that big, is just to freeze them off with cryotherapy. Another method is to, if they're very large, is to have them surgically removed. Will it affect the baby? Well, the baby is nice and comfortable inside, and so it's not going to harm the baby. However, you can have a natural vaginal delivery, and there is a 1 in 100,000 risks of laryngeal papillomatosis, and these are warts that grow on the vocal cords of the baby concerned. The way it's detected is that there's a change in the baby's cry or stridor, in other words the way it breathes or cries in terms of the airflow going through the larynx. If you think your baby has laryngeal papillomatosis because you've had genital warts, and then the paediatrician or the ear, nose and throat doctor can have a look down to make sure it's all okay. But this is a very, very low risk problem, and most women have their warts successfully treated with either cryotherapy or with having the warts cut off. In terms of the potions and lotions, you should not use polydiotoxin, otherwise known as Watercon or Condoline, and you should not use Aldara or Imicramod. These potions and lotions are not licensed in pregnancy and should be stayed well clear of. And if you're pregnant, I would not recommend trichloric acetic acid. It's just not worth it. And so that's effectively warts in pregnancy. Get them treated and you'll be fine. Take care. Bye-bye.